This is Green Street, the environmental health show. GreenStreetNews.org, Patty and Doug Wood, and our worldwide network of scientists, medical professionals, reporters, authors, and others here every week to keep you informed about what is going on in the scientific world and what you need to know to keep yourself and your family safe in this increasingly toxic world. Welcome back. Informational asymmetry is a term used to describe a situation in which one party has a lot of information about something and the other does not. It's usually used in an economic setting, like when you're buying something and the seller knows everything about the cost of the product and you know virtually nothing. But there are other situations in which a group of people know something and an even larger group of people who can be directly impacted know almost nothing. Such is the case with environmental links to breast cancer. A small group of dedicated scientists is busy unlocking the links between breast cancer and environmental exposures, but most of the women of the world know next to nothing about their work. Today on Green Street, we're excited to talk with two of the scientists who are on the front lines of breast cancer research, and we'll hear from them in a few minutes, but first, some of the news items of the week. Patty, what do you got for us this week?
Fish farming.
Fish farming.
Fish farming has a plastics problem. But, I mean, who doesn't?
Everybody has a plastic problem.
Recent research in aquaculture, the farming of fish and other marine organisms, reveals a growing concern. Farmed fish are contaminated with microplastic particles. These studies are troubling because they show that farmed fish are being fed plastics, which can impact their health and also contaminate people who eat fish. Unless something changes, experts warn that this could grow into an issue of food security by threatening a major source of nutrition for communities around the world.
Yeah, sure.
In one new study published in the journal Aquaculture, scientists sampled 26 fish meal products from 11 countries and found plastics in every sample except one.
Wow.
Fish meal is a protein-rich, flour-like substance made from dried and milled wild fish and fish byproducts.
I was going to ask you, what is fish meal?
Yeah.
Sounds like a fertilizer product.
I know. In another study published last year in the journal Environmental Science and Pollution Research, scientists found that when fish were fed fish meal containing plastics, those fish accumulated microplastics in their bodies that closely matched those in the fish meal fed to them.
Duh.
Fish meal is a core ingredient in farmed seafood. However, the fish farming industry is not likely to replace it anytime soon. Fish feed itself is made from a variety of ingredients, often including vegetable meals, oils, supplemental vitamins and minerals, and fish meal.
Just what fish eat in the natural world, right?
According to a United Nations report, fish meal production is slowing due to decreasing wild stocks of fish used for fish meal like herring, mackerel, and anchovies. As a result, fish feed products are increasingly relying on vegetable products, but experts say the high prevalence of microplastic in the vegetables is also a concern and one difficult to surmount.
Man.
According to one author of the aquaculture study, it's not possible to make plastic-free fish meal or fish feed because all foodstuff derived from marine environments is polluted with plastics.
Not only marine environments, but vegetables are contaminated with plastic.
Yeah. The ubiquity of plastics basically guarantees that microplastics will find their way into any fish product, including the feed given to farmed fish. And the toxic effects of consuming microplastics in humans are still unclear, especially in the long term. But depending on the type consumed, there is evidence that microplastics can exacerbate asthma, inflame the immune system, damage internal organs like kidneys, and even make their way into the placentas of pregnant women.
Gee whiz.
There's nothing new here except that it's important that people understand that eating fish, especially farmed fish, a lot of fish today is farmed fish, is maybe not as healthy as they think it is. They should at least be aware. Maybe wild fish should be something they should try to find.
But wild fish even are going to be
contaminated. Yes, they all have it, but it seemed like farmed fish has a greater quantity of plastic in it.
Well, it sounds like they're feeding them plastic.
Yeah, they're feeding them plastic, exactly.
Good heavens. All right, what else you got?
This is about the world's forests and their declining health, which they think is a threat to humanity. Global forest health has plunged to dismal levels and threatens the well-being of humanity. A new damning report highlights how financial systems are pouring money into land clearance and undermining efforts to reduce forest destruction. Since 2021, when world leaders and corporate executives promised to halt deforestation, the new study found that forest loss has actually increased driven by subsidies for livestock, monocrops, logging, and other extractive industries. Last year, 20 million acres of forest, an area roughly half the size of England, were burned, pulled, or cut down, which was higher than the loss at the time of COP26 in Glasgow. The world is now 63% off track to reach that goal, according to the latest Forest Declaration assessment, which is compiled each year by a coalition of civil society and research organizations. Lead author of the study, Aaron Matson of Climate Focus, said, quote, "Every year, the gap between commitments and reality grows wider, with devastating impacts on people, the climate, and our economies. Forests are non-negotiable infrastructure for a livable planet."
What's the
Let me
point?
read that again. Forests are non-negotiable infrastructure for a livable planet, and continued failure to protect them puts our collective prosperity at risk. We already know what works to stop forest loss, but countries, companies, and investors are only scratching the surface. And even those initial efforts are facing strong pushback from the standard bearers of an economic system built on forest destruction. Behind the grim trend is a grotesque imbalance between the finances devoted to extraction and conservation. Agricultural industries, which are responsible for 85% of forest loss over the past decade, have received average annual subsidies worth $409 billion. And this is 70 times more than the $5.9 billion of international public finance provided each year for forest protection and restoration. A growing cause of alarm is the uncontrolled spread of fire, which hit staggeringly high levels in the Amazon last year after record droughts turned swaths of the normally moist tropical rainforest into a tinderbox. The authors of the report said that the fires were pushing the forest closer to a point of no return. Private financial institutions are further tipping the balance. A separate report released by Global Witness found that banks have made $26 billion from financing deforesting companies since the Paris Agreement was signed in 2015, averaging around $7 million every single day.
So what's the point of signing these agreements when they mean nothing to these companies? Companies say, "Oh yeah, we promise, we're not going to do this anymore,"
and the next day they're zero.
The next day they're going back and doing but because the lure of money.
They're making money.
Forests are the lungs of the earth.
Nobody gets it that the rainforests in the Amazon will have an impact on us.
Yeah.
No matter where we live on the planet.
Oh boy.
Yeah.
All right. Thanks, Patty.
You're welcome. The scourge of breast cancer continues to impact women around the world, and the incidence of the disease is increasing globally. According to the World Health Organization, there were an estimated 2.3 million women diagnosed with breast cancer in 2020, and this number is expected to rise to 3.1 million by 2040. Despite the millions of dollars spent searching for the cure, we seem to be no closer now than we were several decades ago. But what we are closer to now is knowing which environmental exposures may be contributing to the development of breast cancer. The Silent Spring Institute, named in honor of Rachel Carson's seminal book, is dedicated to uncovering the environmental causes of breast cancer. Earlier this week, Doug and I had the chance to speak with two of the Institute's scientists, Dr. Robin Dodson and Dr. Kristin Knox, about their work. To get started, we asked Robin to tell us a little about the Silent Spring Institute. Here's our interview.
So Silent Spring Institute has been around for over 30 years now. We study the links between the environment and women's health with a particular focus on breast cancer and trying to understand the root causes of breast cancer. We were started way back in 1994 by breast cancer advocates here in Massachusetts who had noticed elevated rates of breast cancer on Cape Cod, and the traditional risk factors couldn't explain the elevated rates. So the presumption or the assumption at the time was it must be something in the environment. But nobody was really focused on looking at environmental causes of breast cancer at the time. And so the breast cancer activists, Massachusetts Breast Cancer Coalition, lobbied the state to set aside money to create what was kind of called at the time a lab of our own, which is an opportunity to create a research organization dedicated specifically to trying to untangle and understand the environmental causes of breast cancer. And so hence we were found. So I'm an exposure scientist. So I study about how are we exposed to these chemicals in our everyday lives. We have folks on staff who are looking at the health effects, the laboratory studies, and there are people like Kristin who are great at data analysis, looking at the data and trying to pull apart and kind of understand some of the patterns or the trends that we might be seeing in that data.
Okay, and I'm sure that our listeners will want to know what those trends are, what you're finding statistically, but we'll get to that in a little bit. So, Kristin, can you just tell us a little bit about your work?
Sure. So I'm trained as an economist. So I came to Silent Spring to do some more of the kind of data analysis types of projects. Initially, we had a big team that worked to evaluate the effectiveness of California's Prop 65 law, which is a right to know law. So they have a huge list of 900 chemicals and you have to put a warning label. And again, it was very multidisciplinary. So we had quantitative analyses, we had qualitative analyses, we kind of put them all together. We did one where we took data from the California Air Resources Board. So in California, they collect ingredient data from manufacturers who are selling products into the state of California. But it's really hard to find out what's in products sometimes. At a kind of rolled up level, this data is publicly available. And so we use this data set to look for volatile Prop 65 chemicals that were in consumer products. And we found a lot. So that was concerning. But we also found that, there are some chemicals that are in many, many different products. So you might be exposed a little bit from one product, but you're probably using, 10 different products. And it gets even, if you're in an occupation, like let's say you're in a janitorial or a cleaning profession where you're using a lot of these cleaning products, and, the same chemicals are appearing in all the different categories. And so your aggregate exposure could be quite high. So that was one study. We also used the CDC runs the NHANES program where they go around the country and they actually collect blood and urine samples from people. It's a nationally representative sample. And so we used that data and we looked at Prop 65 chemicals, and we were looking at the levels of those chemicals in people's bodies. And specifically, we wanted to know, what happens when a chemical is listed on Prop 65? What do we see? And we actually saw that levels go down in people's bodies after the chemical is listed. The interesting thing was it wasn't just in California. You actually see the levels go down nationwide.
So what do you attribute the nationwide reduction when California is the one that has the Prop 65? That's what you said first. So California, we saw it in California that their exposures went down. It's because of the label. But that label is on so many things all over the country. Is that why?
So we don't think it's just the label. We also think that manufacturers are actually reformulating their products. So they're taking those chemicals.
Because of California.
Yes, which is amazing.
Yeah.
Okay. So could you just give us a little background on that law and just talk about what Prop 65 is, because maybe some of our listeners don't really know what that is.
I mean, so it was a ballot initiative. I actually don't know who was the pushing force behind it. Robin, do you know?
No, but it did have a lot of support from across different sectors at the time. I mean, keep in mind that this is the time in the environmental field where this idea of kind of right to know was really important. And so it just kind of went, which is wonderful. So that was back in 1986. They've been able to continuously list some chemicals on Prop 65 since. As Kristin mentioned, we kind of came together as a multidisciplinary team. And part of that team actually was she works at the Environmental Law Clinic at University of Berkeley. It's Claudia Polsky. She wrote a law review article that was trying to demonstrate that Prop 65 may not have these kind of obvious direct effects necessarily, but a lot of indirect effects that people don't kind of realize. It can be anything from, as Kristin mentioned, businesses just kind of reformulating kind of ahead of it. that hearing that a chemical might be listed. And so they're kind of on the back end, kind of reformulating, more transparency in the supply line. So manufacturers going to their suppliers, asking whether or not their supply stocks have these chemicals in them. There's other things like other states have benefited tremendously from Prop 65. Several states, as well as California, have developed other regulations that build on Prop 65. So they have things like disclosure laws around, say, like cleaning products now have to disclose whether or not a Prop 65 chemical is in a cleaning product directly to the state. So there's all these kind of less obvious, but really important impacts that Prop 65 has had over its 40 years. Well, it's been there. And I think it's important to kind of elevate that and kind of like, well, did you know the kind of thing that this has had such an impact on right to know for consumer products across the country.
Yeah, it's remarkable the impact that it has had. And I agree. I think a lot of manufacturers may look at that and say, what could we do instead so we don't have to put that warning? We don't want to put that warning on our product. So, how can we reformulate? That's so interesting. So with regards to breast cancer, where are we in terms of, I don't want to say the top 10, but what are you looking at in terms of the primary consumer products that you find troubling?
So that's a tricky one because it certainly depends on who we're concerned about, what the population we're concerned about, and things like that, of course. A couple of years, actually, just last year, there was a paper published by Silent Spring, actually our toxicology team here at Silent Spring. It was a paper led by Jenny Kay here, who identified over 900 breast cancer relevant chemicals. And what they did, kind of one of these important things that they found was that we need to look at kind of multiple lines of evidence. So they looked at animal tests. They looked at what we call kind of more like cell-based tests, or even what we call these in silico tests, which are these more kind of predictive models. And so bringing in multiple lines of evidence, they were able to identify over 900 chemicals. And those chemicals are found. They're working on a paper right now trying to show which kind of sectors and where those chemicals specifically are being used. But we know that they're being used in pretty common products that people may encounter every day. So it's a kind of a hard task to kind of whittle down so quickly, right? I think it's really pretty remarkable that there's over 80,000 chemicals in commerce, and we got that list down to 900 priority products or priority chemicals. And so we're continuing to kind of identify certain priorities. As an exposure scientist, maybe I think of myself sometimes as like a detective. So if we have certain kind of patterns that we're observing, we may then want to kind of investigate that further. So for example, one thing is that we know that Black women specifically have higher levels of exposure to certain chemicals, and those chemicals are endocrine active. We also know that Black women experience higher prevalence of certain endocrine-related or hormone-related health effects, including more aggressive forms of breast cancer. And so that is actually one area right now that we're doing a lot of research, is trying to understand what's going on there. Why are some women, Black women in this case, more highly exposed to certain chemicals? A lot of those chemicals are found in consumer products and personal care products. So we are now specifically involved in research that's trying to understand what are those product use patterns, and could that help start kind of explaining why we see these differences. So again, that's kind of we start from what are we observing, what are the patterns we're observing, and try to kind of go backwards and trying to understand what might be driving that. Now, of course, if we're thinking about other, workplace exposures or things like that, we might ask different questions, and different chemicals may kind of bubble to the top in terms of what we're mostly interested in.
So I have a very specific question, and that is, we're in a crisis globally around plastic and these tiny microplastics and nanoplastics that are everywhere, including inside our bodies. But it's not just, when people just think of plastic, they don't think about the chemicals that are in the plastic. And so when it's inside our body, we're not only getting these particles, but all the chemicals that go along with them.
Yeah, actually, so just last year, as the International Plastic Treaty was kind of being negotiated, Silent Spring published a paper where we took that breast cancer list that I previously mentioned, and of those which are actually used in plastics, and found a fair amount of those chemicals are used in everyday plastics, as another way to kind of elevate the idea that these chemicals are in our everyday products. They're in the products that we use every day and the plastics we use every day. And so that's one way that we've been thinking about that. But we've been studying plastic associated chemicals for years. In fact, phthalates being one of those chemical groups. Silent Spring was one of the first to study those, not only in our homes, so in the air and then in the dust in our homes, but one of the first to actually test those in products. And so phthalates are an example of an endocrine active chemical group. So in particular, they affect reproductive and development. Some of those phthalates are used at significant levels. So vinyl products in particular. We tested a vinyl shower curtain, for example, a quarter of it by weight was one phthalate, this DHP, which is one of the more potent phthalates. So it is pretty remarkable about how many kind of plastics we encounter in our everyday lives and how that is introducing those chemicals into our homes.
Okay, so what does an organization like Silent Spring, which is relatively small compared to the big pink ribbon organizations that are out there, what do you do specifically or specially for Breast Cancer Awareness Month?
We're really all about the science, but we're also about getting our science out there to everyone. So for example, we always publish our papers open access so that anyone can read them. We do a lot of community outreach. When we're doing our research studies, we often have a community partner. So for example, I'm working with a cohort of nurses now in San Francisco, and we're working with a woman who's in their union. And so as we do the research and we get the results, we then go back and communicate it to the nurses.
Right.
And I mean, Silent Spring has also really kind of pioneered individual report back. So when people participate in our studies, they actually get their results back. And we try to give them back in a way that they can understand. So this is like what your numbers are, but this is just a big, scary number. And let me put that in context.
Yeah, let me explain
this is
what
where
that
you
means.
are.
Yeah.
Right.
Yes. And we're also working to educate doctors and people in the medical profession. So there's not a lot of training right now in medical school about environmental toxins.
That's right. It's so important to teach the medical community about this stuff because, they see women coming into their office and they do the screening and so on, and the women are diagnosed with breast cancer and they don't ask questions about, what are you using for your personal care products? And, what do you use to clean your house with? And are you using Febreze and other, scents in your home? I mean, these are the things that need to get out to the general public so they can stop those exposures, thereby, reduce their risk.
Well, let me ask
crazy.
the question this way. What do you wish people knew about Silent Spring and about the work that you're doing?
Well,
Good question.
That is a good question. I think one thing that's kind of fundamental that oftentimes when we talk about environmental risk factors for disease is that people don't realize that a lot of chemicals that we encounter in our everyday lives in the products that we use are not fully tested for safety before they're able to be used here in the United States. And that is a problem. It's a problem because I think a lot of people might go into their store, they're looking on the shelf, they're trying to pick a product, and they don't realize that most of those products have not actually been evaluated for whether or not they're safe or okay for your health. And that's a concern. And people kind of go in thinking, oh, well, somebody's probably thought, this through. Unfortunately, no. Here in the United States, we do not do that. We take kind of a reactionary approach instead, where we do not fully test chemicals before they're added to products. So I think a little bit it's kind of shifting the mindset of thinking about chemical exposures and just kind of bringing to light the fact that unfortunately right now we're kind of all guinea pigs in this laboratory experiment about what chemicals might do to our health.
Exactly. And now with these agencies in Washington, just kind of dropping some of their research activity is got to be a little bit discouraging.
So speaking of being discouraged, Kristin, Robin, have we made progress and are you seeing more progress in the future?
I think we have definitely made progress in the past. I think this is a little bit of a rough time, but I will say I'm optimistic about further in the future that kind of a focus on funding science will come back.
I also think this time has forced us to be a little bit creative in terms of thinking of other ways to kind of advance the science. For example, there's actually a lot of great work at the state level that's happening around thinking about chemicals and regulations around chemicals. So while the federal government is not taking up any of that right now, the states are stepping up. And so I think there's just other ways that we're approaching or how our science can have an impact. So at the state level, there's also things that could be done. And we're trying to do, working with different partners at kind of the marketplace level. And then, of course, just empowering consumers, empowering individuals to make kind of healthier choices.
Right. Can you just talk a little bit about BPA? I think, in the work that you've done on that, because I know you've worked on that.
Yeah, so BPA is listed on Prop 65. So it was included in our analysis where we looked at the levels, in this case, it was in people's urine. And we did find that when it was listed on Prop 65, after levels came down in people, but at the same time, we found levels of BPS, so bisphenol S, which is a substitute, went up. And that one was not listed on Prop 65. So it was kind of an example of what we're calling regrettable substitution.
Right.
You list one and then they just switch into another chemical that is, probably equally bad. It does kind of support the argument for why we need like class-based regulation. So rather than this chemical and this chemical, you need to do the whole group.
Absolutely. Cool.
Exactly. Arlene Blum, I'm sure you're familiar with her work. Then she's all about the class of the whole class has to be regulated or, removed from consumer products.
Is there anything, Kristin or Robin, that we didn't talk about that you wanted to talk about?
Yeah, just kind of a message for Breast Cancer Awareness Month to our listeners.
Sure.
From your organization would be great.
Yeah, Kristin may have some thoughts too, but I think one thing that's really important is that we take this energy around breast cancer awareness and use it towards trying to empower consumers to make healthier decisions. And one way that we try to support that is that we actually have an app called Detox Me, which has nearly 300 science-backed tips to help reduce exposures to these chemicals that we've been talking about in our everyday lives. So it's basically, we developed this app because every time we put out a paper, we develop kind of top tips from each of the papers. And we realized instead of having a bazillion fact sheets, that maybe we should just compile that all into an app. And that app is free. It's in English and Spanish. It's for your iPhone or it's for an Android phone. And so we encourage folks to check that out to it just helps and supports consumers to make healthier decisions. That said, this cannot be solved simply by consumer action, nor should we put all of that burden on the consumer to make better choices. But folks should also get engaged, vote, support both policymakers and policies that can help limit our exposures to harmful chemicals.
And I'll just say, so I came to Silent Spring 6.5 years ago, and I had no background in any of the science-related stuff. I very much was coming in as a data person. And so initially it was very scary because I was learning about this whole new world, right, that I just wasn't even on my radar. What helped me was that there were many small changes that were super easy for me to do that I could do in my house, in the products I use to kind of reduce my exposures. And so I agree with Robin, it can't all be on the consumers, but I did find it empowering that, these are the things I can do. I can't control everything, but I'm going to do these little steps, and every little bit that you do helps.
Dr. Kristin Knox and Dr. Robin Dodson from the Silent Spring Institute talking about their work uncovering the links between environmental exposures and breast cancer. You'll find links to the Silent Spring Institute, links to the news stories we covered today, and all of our past shows at our program website, greenstreetnews.org. That's going to do it for our show today. Patty and I will be back next week with another edition of Green Street. Thanks for listening.